Welcome to another review class for our very diligent practitioners from the Philippines. So today we shall be focusing on rheumatoid arthritis, the clinical manifestations and their implications. This is an in-depth exploration of RA, including symptoms, pathology, and complications. Okay. RA is a chronic autoimmune disorder. I think everybody knows that. Characterized by persistent inflammation in the joints, not only the joints, but other tissues as well. It predominantly involves pain, swelling, and can result in significant joint deformities over time. So always be observant. If the first thing that you notice would be the deformity of the joints, then you already have an idea what your patient probably has. Okay. Okay, what are the local symptoms of RA? Pain. This is the hallmark symptom of RA, often experienced as persistent ache, so paulit-ulit, no? This can vary in intensity, could be mild discomfort to severe pain that can hinder daily activities. Swelling. Swelling is very dampness. Okay. Swelling around the joints is due to inflammation and increased synovial fluid. So this will notice a change in the joint's appearance, making it look larger and often feeling warm to the touch. So if it's warm and there's swelling, so ano po yun? What's the diagnosis, Ma'am Trix? Damp heat, right?
Heat.
Yeah. Okay, tenderness. Tenderness would indicate inflammation and sensitivity, even light pressure. So can cause discomfort. So that's very excess. So making it difficult for patients to engage in normal activities without pain. Okay, let's talk about motion limitation and deformities. Limitation of motion is a common symptom of RA. So this results from inflammation and damage to the joints. Of course, this can hinder their daily activities. Oh, ito number one to, morning stiffness. This is a hallmark symptom of RA. So how long does it last? More than 1 hour after waking. This is relieved with movement and physical activity as the day progresses. So you start asking, does the patient feel better when he starts moving around upon waking up, no? Then the deformity of the joints. This is a serious consequence of RA due to chronic inflammation and instability. So the common deformities, ulnar deviation, and various finger joint changes. Okay. So let's talk about etiology of RA. So there are only two. Could be infection. Infection is believed to play a role in triggering RA, particularly through the presence of certain pathogens that initiate an autoimmune response in genetically predisposed individuals. So there are people who are probably not too lucky to be born, but very they inherited it from their parents, from their ancestors. A key factor is autoimmunity, where the body's immune system mistakenly attacks its own joint tissues, leading to inflammation and damage. Okay, pathology of RA. So RA primarily affects the synovial membrane. Oh, dapat tingnan mo talaga yung synovium niya, no? This inflammation results in, so if there's inflammation, there will be destruction of the cartilage and bone, ultimately causing significant joint damage and dysfunction. Now let's go to, we're done with local symptoms. Let's now go to general symptoms. Fever. This is often seen during disease flare. So nagfi-fever siya. So what does this tell us? There is underlying inflammation within the body. Weakness. This can result from both inflammatory processes and fatigue associated with chronic pain. This may affect daily activities and contribute to overall disability. Easily fatigued, no? Often exacerbated by chronic pain. Ikaw ba naman na parating may pain, so you will always feel fatigue, no? Inflammation, of course, because of the pain, you will have poor sleep quality. So patients may find it challenging to maintain their usual level of activity. So, what are the typical presenting symptoms of RA? Yung pag unang tingin mo pala, alam mo na RA na kaagad, no? So, they experience early morning weakness that lasts for more than 1 hour and which typically eases with physical activity. The first to be affected are the small joints of the hands and feet, highlighting the progressive nature of the disease. So, ano yung patterns of joint involvement so that you can distinguish it from other types of arthritis like OA, no, osteoarthritis. There is symmetrical joint involvement, so that means dalawa siya, both. Monoarticular involvement can be observed, so only one joint, no? Oligoarticular pattern is explained. Polyarticular involvement is noted. So what are the common deformities? This one, you cannot miss, no? Kasi nakikita mo kaagad eh. Ulnar deviation, swan-like deformity, boutonniere deformity, Z-line deformity, and sub-Q nodule. Let's talk about ulnar deviation in RA. The fingers will bend towards saan ba ulnar side, no? Ulnar side, yung pa dito, towards the ulna. This condition often results from subluxation of the MCP, metacarpophalangeal joints, leading to functional impairment and challenges in hand dexterity. Swan neck, di ba? Swan neck deformity. There is a specific pattern of joint positioning where the PIP, proximal interphalangeal joints, is hyperextended while the BIP is flexed. This deformity typically arises due to imbalance in muscle and tendon function around the finger joints and is common in advanced RA cases. Then the boutonniere deformity. This is a specific joint deformity where the DIP joint is hyperextended while the PIP joint is flexed. So later we're going to show you pictures. No? This abnormal positioning is a result of the disruption of the extensor tendon mechanism and can lead to functional impairment in hand movement. Z-line deformity, subluxation of the first MCP joint accompanied by hyperextension of the first IP joint. This leads to functional impairment and altered hand mechanics. Okay, another very prominent feature is subcutaneous nodules. These are firm lumps that develop under the skin in approximately 30 to 40% of RA patients. They are found near pressure points. They are associated with higher degree of disease activity. So this is a significant marker of the condition severity. So if you see a lot of sub-Q nodules, this is a sign na medyo severe na yung RA niya. So what are the associated diseases with RA? Pwede rin magkaroon ng OA, osteoarthritis, particularly when there is involvement of the DIP joints. This often complicates the clinical picture and management of patients. You can also have pulmonary involvement. No? A common complication is pleuritis. So there is chest pain and dyspnea, okay? And interstitial fibrotic disease will impact the lungs. So this patient may have dry cough and shortness of breath. Pleuritis, let's discuss it. This is also known as pleurisy. This is characterized by inflammation of the pleura. The pleura is the membrane surrounding the lungs, no? So there will be sharp chest pain, difficulty breathing, and may be accompanied by pleural effusion due to increase in monocytes and neutrophils. Interstitial fibrotic disease in RA. This is a serious complication of RA. Okay, because in interstitial fibrotic disease, there is already scarring of the lung tissue, no? So when there's scarring, medyo it's a little bit late na. So there will be progressive respiratory issues. So especially if the cough doesn't stop, no? So dry cough, shortness of breath. And of course, the quality of life will be affected. So if you see patients with RA, it's best to see them like, of course, they will be your patients forever because your goal is to prevent the complications, no? So what about cardiac involvement? So there can be pericarditis, chest pain, cardiomyopathy, okay, heart disease symptoms, and increased heart failure risk. So let's try to understand pericarditis. It occurs in 10% of patients, with additional 50% potentially having undetected cases. So this is usually undetected. So what causes this? There is swelling and irritation of the pericardium. And when this happens, there will be sharp chest pain and discomfort, especially during breathing or coughing. Cardiomyopathy. So in cardiomyopathy, there is already inflammation of the heart muscle. Of course, there will be heart complications, no, eventually. This can arise from necrotizing or granulomatous myocarditis, coronary artery disease, or diastolic dysfunction, leading to weakened heart function and potential heart failure. Ang dami na, di ba? And this one is also common, mitral regurg or mitral regurgitation. This is due to the inflammation and damage caused by the disease. So there will be fatigue, shortness of breath as the heart struggles to pump blood effectively. Vasculitis, no? This is a significant vascular complication of RA. So there's already something wrong with the blood vessels. There is inflammation. Kaya it's called vasculitis. So when this happens, you will see skin lesions, organ dysfunction. Okay? Anemia associated with RA. So normochromic normocytic anemia is a common complication. The degree of anemia often correlates with the level of inflammation. So usually patients with RA often followed up by regular serum levels of CRP, active protein, and erythrocyte sedimentation rate, ESR. No? Okay. The normal, this is common in RA, normochromic, normal shape, normal size. Okay. It indicates reduction in red blood cells while maintaining standard hemoglobin concentration and color. Next, Felty syndrome. We want you to be very familiar with this syndrome. So this is a rare autoimmune condition that typically occurs in the late stages. So since it is a syndrome, it consists of symptoms, no, like splenomegaly, enlargement of the spleen, neutropenia. So when you check the neutrophil count, it's quite low. So often leading to, of course, including the RA. So it's RA, neutropenia, and splenomegaly. So there will be increased susceptibility to infections. Excuse me. So neutropenia is a condition characterized by lower than normal number of neutrophils. It increases the risk of infections if your neutrophils is low, no? Splenomegaly, enlargement of the spleen, okay? So this will cause abdominal discomfort, of course. Nodular RA, the presence of subcutaneous nodules that typically occur in areas subjected to pressure, indicating a higher severity of RA and often correlating with disease activity. Okay? So that's about it. Thank you.